Hello, happy Friday, Evolve community. It's Health Literacy Tip Friday. So, keeping in line with what we've been talking about this week. So, we started off Monday with thinking about trying to be mindful about how we judge ourselves and how we judge others as it relates to meeting health goals. That applies to the layperson, that applies to the healthcare provider, it applies to us all. And then on Wednesday, I came and talked about some different types of biases that healthcare providers can perpetuate. And so, again, keeping in line with judgment. And so, I want to talk to you all today about what do you do when you feel like your healthcare provider is exemplifying, is acting out some bias, plain and simple. So, there are a few things that you can do. The first and foremost, I want to encourage my clients to feel empowered to open your mouth and really vocalize what it is that you're feeling, especially if there's a track record, especially if there have been multiple incidents that lead you down this path to think like, hey, something is not feeling right. It's not sitting well with me. Definitely speak up and say something about it. Now, I say that knowing that it is not an easy thing to do. I get it. I've had clients to say, I don't want to come across as difficult, or I'm afraid, or I don't have the language to use. So I understand that completely. And so again, it's not an easy thing to do. And if you are in a place where you feel comfortable speaking up, then please do so. Just having a conversation with your healthcare provider saying, hey, I noticed this. I noticed you said this. Can you explain this to me? Or is there a reason why you are doing this? Just to get an explanation so that you can open the door for communication. Now, if you do not feel comfortable talking to your healthcare provider, you can always go to leadership. So, healthcare office, a facility, if you're in the hospital, there's always someone else that you can talk to that may supervise that healthcare provider. So you can ask to speak to their direct report. You can ask to speak to the medical director. You can ask to speak to a charge nurse. You can ask to speak to attending physician to certainly discuss your grievances. Also, there are also patient navigators who are in that position specifically to help patients with any concerns that they're having. Now, I've often had to talk to leadership about things that were not going well. And, it's really unfortunate, but a lot of times that's how you see change, when you really start to vocalize some of your concerns and make sure that you get other eyes on the situation, and things can really start to turn around. It's unfortunate that sometimes that's how the route that you have to take, but in order to get best care, optimal care, just to let people know that you are in tune with what's happening, and you definitely deserve better care. Third thing that you can do is engage an advocate. Again, as I was speaking to how difficult these things can be sometimes, to have these conversations and feeling like that there may be some form of retaliation against you, or, your care may be compromised just because you speak up, and that does happen. So again, I'm not minimizing that, and if you need someone to be an advocate for you, that's one of the reasons why we're here at Evolve. But again, it doesn't have to be us. We're one avenue, we're one channel, but if you have someone in your life that is a supportive person, someone that you trust well, to kind of step in and advocate for you, especially when you're not feeling well and you don't have the strength to speak up, or you're just not in a mental or physical state to have those conversations. So it's really important. And even I talked, I believe last week, about having a healthcare power of attorney. So again, that's someone that can speak for you, and just be a part of your healthcare journey. And then lastly, if you try these things and all else fails, you're not really gaining ground with seeing a change in your healthcare providers' behavior and the care that you're receiving, then I hate to put this on the patient, but because it does take a lot of energy to find a new healthcare provider, whether it's looking to see who's in your network and just finding someone that you can connect with, that resonates with you, and you feel comfortable in their care. It takes a lot, but that is an option, is to really just say, you know what, I gotta march with my feet. This is not working. I've tried, I've exhausted all other solutions. I need to find a new healthcare provider. So those are some things that you can do if you find that your healthcare provider is acting in a biased manner. And if you have any questions, feel free to DM me. If you are a healthcare provider and this is your vibe and you want to make sure that you are seeing and treating patients and not being influenced by bias, and let me hear from you. And if you like this content, if you know a healthcare provider, if you know some patients who are needing some assistance, tag them, share our page with them. And until next time, guys, take care. Energy of love, wellness, and evolution always. Bye-bye.